Hello, my name is Angela Nicholson, and I would like to talk for a moment about an issue that affects my major of diagnostic medical sonography. For most pregnant women, taking precautions against risks to their unborn child that are within their control is a very common part of pregnancy. Things like avoiding smoking, avoiding drinking alcoholic beverages, all the way up to avoiding the use of saunas and hot tubs. However, would you avoid something that gave you the opportunity to bond with your unborn child, even if it carried the potential for harm? Through research and a warning announced by the U.S. Food and Drug Administration, I will explain ultrasound, what keepsake ultrasound is, the perceived risks versus the benefits, the lack of evidence of risks or harmful risks, and the ethical views on the use of keepsake ultrasound. So, though ultrasound has become a very commonplace and useful medical tool, not all are aware of what it is. So, very simply, it is the use of high frequency sound waves projected at a structure that bounce back to create a picture of that structure. Ultrasound has also become a very common tool for the use during pregnancy. There's very little perceived risk with the use of ultrasound in a medical setting. This is because physicians, technicians, midwives, and all those who use ultrasound in a medical setting have had training and are aware of how to use the equipment effectively and safely. The two main concerns of ultrasound are tissue heating in the area that's being scanned and cavitation, which is the formation of bubbles due to free gases. There are no free gases near the fetus, so cavitation is not considered a risk for prenatal ultrasound, but tissue heating can have dangerous consequences. Studies have shown that heating the maternal temperature or raising the maternal temperature can cause neurological defects in a fetus. A keepsake ultrasound is one that is performed for entertainment or bonding purposes. It has no medical benefit, and it is a direct-to-consumer service, so it's not performed in a doctor's office or hospital setting. And because it lies outside of that clinical setting, it is not strictly regulated like hospital equipment and staff are. There's no doctor to oversee, nor does an individual operator of the equipment have to be medically trained. See, a certified sonographer is practiced in how to safely perform a prenatal scan, such as not scanning a fetus's heart or other major organs for too long. The equipment in hospitals is also calibrated to the appropriate and safe frequency setting and maintained by sonographers as well as biomedical technicians. Keepsake ultrasound businesses are not held to the same standard, which can lead to improper use of equipment or equipment that's not maintained at a safe setting. The keepsake ultrasounds themselves can also be longer and more frequent. In this page that I have printed out from a local keepsake ultrasound business, you can see that they offer several packages in the 3D, 4D ultrasound category. There is no time listed in any of these packages, and they also guarantee that they will determine your child's gender, or you can come back free of charge within a certain allotted amount of days. They also offer a discount if you use their service more than once during the same pregnancy. When considering the issues in regards to prenatal ultrasounds, studies have shown little risk, but caution should be exercised, as the studies on human fetuses are biased because of the groups of individuals who were studied. Those who actually had more ultrasounds during their pregnancy encountered problems typically or were high risk. Therefore, it's difficult to determine if the ultrasounds had an effect on that fetus or not. These studies are also outdated, and the frequency output of ultrasound machines has gone up dramatically in the past 20 years. Here, I can show you the difference between the traditional 2D ultrasound. We have a 3D or 4D, and then we have HD or HD Live. HD is a very clear, you can even determine skin tone, and as you can see, that really does give you a really nice picture of your unborn child. The changes in the amount of acoustic output make these dramatic differences in imagery possible, but more studies are needed to determine their safety. A woman typically receives 2 to 3 ultrasounds during a normal or low-risk pregnancy. These scans, performed in a hospital or clinical setting, are typically about 15 to 20 minutes in total length. In a keepsake ultrasound setting, and as you can see from what I've showed you on this business website, excuse me, They are done to achieve a perfect picture or to determine a fetus's gender. So the amount of time goes up dramatically to as long as an hour. In one documented situation, a woman brought her keepsake ultrasound video and pictures to show her OBGYN. Her doctor noticed that the frequency setting of the machine that was used was not appropriate and that the individual who performed the scan spent far too long focusing on the fetus's heart. From an ethical perspective, the issue of whether keepsake ultrasounds are a service that can be justified by the principle of autonomy, which is having the decision-making ability in your own healthcare. But for autonomy to be followed, the patient must have all pertinent information so that an informed decision can be made. And in the case of keepsake ultrasounds, the patient is not typically made fully or at all aware of the risks of the scan performed in that setting. This information and other research has gone into many, many studies on whether the services are ethical, and each study that I read during my research, from a medical perspective, they're not considered ethical. However, this business does thrive on marketing to the appeal of parents who wish to bond with their unborn child and the ability to allow more family and friends to be part of that bonding experience. If parents are made aware of the potential risks and the facts about the differences between medically prescribed ultrasound versus keepsake ultrasound, they might choose differently. So, in conclusion, though medical ultrasound is considered to carry very little risk, that is based on the fact that it is medical. It is a medical diagnostic tool and not for the purpose of entertainment. Its use in the direct-to-consumer market it's questionable at best and potentially hazardous at the worst. The experience of bonding with your unborn child may have the ultimate appeal to soon-to-be parents, but the risks should be explained, weighed with the benefits, and all questions answered by a medical professional. Consumers should absolutely heed the warning of the FDA, as the use of prescription medical equipment can also have legal ramifications when it is done so without a prescription and until further studies are done to determine its safety.